I'm John Beckert from Forward Janesville, and it's my pleasure to welcome you to join the Forward Janesville All-Member Conference Call. We do, however, have some special guests today. We've invited members of the Beloit Area Chamber of Commerce to join us, and we welcome all of our Beloit friends to join this conference call. Obviously, the topics, as you saw in the promotion of this, are relevant to the entire area. We have Noelle Sandoval, who's the health officer for the Rock County Department of Health, and we have James Otterstein, the Rock County Economic Development Agency manager, and of course we have Dan Cunningham, Forward Janesville's Vice President of Government Affairs. We will be hearing from each of them. I want to also say we are very encouraged to see the number of callers growing week to week. Evidently, this is hitting a nerve with a lot of you, and we greatly appreciate that. So let's get started. Noelle Sandoval, I'm going to give you the chance first to update our callers on the COVID-19 effort to flatten the curve on the COVID-19 pandemic, and then your efforts to support area health providers and keep our citizens safe. So, Noelle, with that, you have the floor for 10 to 15 minutes.
All right, thank you so much, and thank you. I really appreciate the opportunity to come on your program and talk about, this big enemy we're all facing together. Many of you may know that we do have a very active website, and the day-to-day data is posted and updated daily in most cases, and in some cases weekly. When I checked this morning, we had lab-confirmed cases, 361 in the county, and negative test results, 3,378 with 13 deaths. So those are the stats at this time. They'll be updated this afternoon. So one of the questions people ask is how has the county been managing the crisis? So the first thing I want to point out is that we, this type of work, case investigation, contact tracing, we do that every day on a daily basis. And I want to say that public health is sort of the best kept secret. We do our job and nobody notices. But with this COVID, everybody's noticing because of the magnitude. This is large scale. But we do routinely investigate communicable disease outbreaks. For this one, it is such huge and large scale and scary and so many unknowns. We have started our normal process. We have infrastructure in place, identifying gaps. How can we report information, working on efficiencies? How can we improve better, streamline processes, et cetera? We are very fortunate to have a very knowledgeable epidemiologist on staff, and he provides us with a lot of data. And so we use that data to inform us how we're doing what we're doing. He gives us information like the numbers I just told you, the new cases, the lab confirmed, probables, et cetera. And then he also provides demographics. He takes that data, looks for trends, looks for demographic patterns, things like that, to guide us in where we might want to channel our efforts. So one of the biggest challenges because of the large scale has been staffing. So we normally have 9 public health nurses on staff. We also have, and so they have the primary charge of the case investigation and contact tracing because that's really our biggest role in this outbreak. And then we also have 9 environmental health specialists, and they routinely do outbreak investigation when it comes to things like water or foodborne outbreaks, things like that, vector-borne illnesses. So we have been able to fairly easily redeploy anywhere from 50 to 80% of their time to work on this COVID situation with us, hand in hand with the nurses. Additionally, we've hired 7 limited term employee nurses to come in and help us. And then the county, we've requested some redeployment of some staff who have certain skills we're looking for. About 20 staff have been redeployed to us, not fully 100%, but some time of these 20 staff has been devoted to us, and we're in the process of training them up. Most of these county redeployed staff are from the human services section. They're social workers or others who routinely work directly with clients on challenging situations. So they have that ability, that knack and that personality to deal and relay information and obtain information from people. So in addition, for our capacity, so we have staffing that we've ramped up. We are trying to increase capacity moving forward. We request contact tracers assistance from the county in particular as we're moving forward with some community-wide testing. And then the county is going to request the capacity to hire additional contact tracers as necessary. So we rely a lot on partnerships, local, regional, and state partnerships. As I mentioned earlier, we have that community information website so that the community is informed. We do some very targeted information send out to particular populations as well. And so moving forward, the next thing, we're continuing to work on this, but the thing that's been at the forefront of our efforts has been how to prepare with our local businesses when we begin opening doors, when we start turning the dial. And so the overarching goal, of course, for everyone is to open safely. And it's really crucial for public health and the economic sectors to work together so we can strategically assure the health and prosperity of Rock County. If we open too soon, it will result in needless suffering and could really set us back. So we need to step carefully, and we need to do it in partnership. So one of the things we've been working on is looking at metrics, data metrics, and planning for a framework from the public health lens for a deliberate process for opening safely. And we're looking at things like that mirror and go hand in hand with the Badger bounce back. And then also looking at our partners in our region. But we're looking at things like 14-day trends of cases. What's our daily increase? How many new cases are we getting today, per day? What is our doubling rate? What are the numbers? What are the metrics looking like for COVID-like symptoms? People, showing up at the doctor or ER with those types of symptoms. And then another metric we're looking at is lab capacity testing. The goal would be to obtain lab results from the labs within 48 hours. And are we meeting that goal? And looking at some of these metrics that would inform us on our capacity to open safely. And as we hit some of these metrics, we could open different sectors safely. So one of the other key things, in addition to looking at metrics like cases, lab, hospital capacity, what even is public health capacity for contact tracing and follow-up, is working together with the community. And I'm aware that several different sectors, business sectors of the community, have formed task force and are working together to look at things. And I would really encourage working with us. You have the business lens and we have the public health lens, and maybe working together if we could form an overall task force for the community, taking all of those factors into account so we can open and have prosperity, but also safety. We're also helping businesses, as the dial's been turned a little bit, we work very carefully with our businesses to help guide them and inform them on what they can be doing differently or better or safer. we've been working with the schools for high school graduations, and they've shared their plans with us, and we've helped evaluate how, or give them information about, well, if you do this instead of that, it might be a little safer. So overall, I guess, I don't want to take up all of the time here, but I would like to encourage all of you business partners out there to partner with us. We need to all work together, and I would say enacting policies, procedures, having a written plan for the businesses, working sector by sector, bringing sectors together to plan. What does that look like, for example, for all the different specific types of businesses? What does that look like opening for faith-based organizations? What does that look like? And bringing these groups together and letting them figure out what works for them. Each sector knows their business. We don't know your business, but we do know public health, and we're looking at the data. So I think if we could all work together, that would be optimal. So that's all I have for now. Thank you for your time.
Thank you, Noelle. And you've hit on several themes that I know we're going to revisit here in this coming hour. Appreciate that perspective. I'm going to shift now to James Otterstein, the Rock County Economic Development Agency Manager. James has been the architect behind a new program, the Rock County Small Business Emergency Loan Program. I think I got that title right. And James, I know you have already launched the program. We've talked about it on this program before. Maybe you could give a status update. There might be callers who are not familiar with the program. So if you would start with that, I'd appreciate it. James?
Thank you, John, and thank you to everybody who's tuning in today. So I'm just going to give a high-level overview of the program and proceed into a quick status update. And then certainly we could address any questions either at the tail end of this call or certainly afterwards. But in any event, back in March, late March, the original concept for this Emergency Small Business Loan Fund was presented to the County Board of Supervisors for initial consumption. Then shortly thereafter, by April 9th, there was a formal resolution approving the creation of the fund, and the fund itself is up to a $1 million small business loan fund. April 24th, the actual application period opened online, so all the applications are accepted and submitted via online, and that particular URL or web address is simply rocksbloan.com. So rocksbloan.com. It's not super catchy. We just wanted to make it easy to remember and easy to type in, so that's what it is. But in any event, so the purpose of the fund is simply this. It's designed to help stabilize, sustain, strengthen, and or restart business operations, specifically geared at small businesses, and those specifically in the hospitality and business services are prioritized. However, it's open to all for-profit private sector businesses that are considered in good standing, that are not operated as a home-based business, and those that have been in business for at least 12 consecutive months in the county, that have 20 or fewer employees, have less than $1 million in annual revenue. Ineligible businesses, again, if you're over one of those thresholds, you got more than 20 employees, you haven't been in business for 12 consecutive months, you happen to represent a hobby, part-time, or home-based business, as well as a handful of other restrictions would prohibit businesses from applying. The loan proceeds or the use of the loan funds are fairly straightforward and mirror those that are associated with perhaps some of the SBA programming. So again, payroll, mortgage, rent, utilities, supplier vendor obligations, fulfilling purchase orders, purchase equipment, machinery, specific tenant upfit and or leasehold improvements, job retention, creation and or talent development, as well as the ability to serve as, matching funding and or a bridge to leverage other recovery-related funding and or to secure long-term permanent working capital. So based on that, applicants and or borrowers can't use this fund to basically refinance existing debt. It's not intended to be used to pay for owner salaries or investor dividend payments. or other uses that are inconsistent or in conflict with the fund itself. And again, all these details are in a 2-page summary that can be found online. So you go to that particular URL that I referenced, and right up in the header bar, you can click on some highlighted text, and that will call up that 2-page summary for folks. In terms of the loan amounts themselves and kind of the rates and the terms, so maximum amount is $20,000. So just because somebody applies for $20,000 doesn't mean they will be necessarily automatically granted $20,000. The rates themselves are going to be set not to exceed 2%. 6-month deferral period for both principal and interest, and the maximum term of the loan shall not exceed a total of 5 years or 60 months. There's no prepayment penalties, no application or origination fees. However, monthly late fees and loan default processes will apply accordingly. Personal guarantees are going to be required from any applicant that has a 20% ownership stake or greater. Collateral also is going to be required. Unlike some of the SBA programs, this is not a forgivable loan. This actually has, an amortization schedule, and there's obligations associated with it. And so therefore, we're going to have security requirements to back it up. If and when required, depending on the scope and nature of the project, as well as the applicant's financial history, as well as their current operating trajectory, there may be additional conditions that will be placed on the particular loan themselves. So as an example, we may require some sort of independent third-party business advisor or advisor's role to be attached to that. So that could be, somebody from the Janesville Innovation Center or our Rock County Entrepreneurial Business Development Program, somebody from SCORE or the University Small Business Development Centers, or fill in the blank, right? Somebody who provides that service for folks. Could be the GE Beta program, Iron Tech, so on and so forth. So we want to make sure that not only are we setting these folks up with financial stability, but obviously some operational stability as well. We're running about an estimated 3-week turnaround time frame from the time that a submitted application is provided to us that we have an actual decision. And so what does that mean? The reality is we processed 15 loans here recently in terms of the applications, took those to a 7-member loan fund committee that met on May 5th. And those individuals were notified of the outcome of that particular decision or decisions from the loan fund committee. And our goal is to have loan documents and closing and funds distributed within about a 2-week time frame. So moving relatively quick in the scope of things, maybe not necessarily as quick as perhaps some of the SBA experiences, but the reality is we're trying to do this right. We're trying to get it done with one shot, and more importantly, we're trying to get it done in an expedited fashion when we create a program from scratch. So I think we're moving at a pretty good clip. Obviously, there's continuous improvement that we continue to look at and implement in our processes, but we're cooking along. So the loan applications themselves, obviously a variety of objective, quantitative as well as qualitative information that they're ranked and scored accordingly on, and those recommendations again are presented to the loan fund committee, which is made up of 4 county board supervisors and 3 members of the general public. Each one of those representatives have a variety of experience in small business ownership and or management in some capacity, shape, or form, whether it be past or present. And so it's a very eclectic and a very intelligent group that we've put together to bring recommendations to for those folks to make final decisions associated with these loans. So once their decision has been made, those decisions are final. There potentially could be an opportunity for an applicant to reapply if certain conditions warrant that, i.e. if there were certain adjustments made to the basic fundamental rules and or guidelines associated with the program. So case in point, if within 2 to 3 months or even 4 months into this particular program experience, there's a particular area within the economy and or a particular threshold that needs to be adjusted on the eligibility requirements, those could be looked at that time, and if those changes were to be made, that could certainly open up or adjust things accordingly. So in terms of the actual fund life cycle, the reality is the fund will be active as long as there is a need, and more importantly, as long as there are resources in the fund. So as conditions warranted at the local, state, and or national level, certainly the County Board of Supervisors has the ability and discretion to expand or contract the overall time cycle. But the reality is we want to make sure this program, certainly is available for the maximum amount of applicants that we can generally help support. And so just to give some high-level summary of kind of what the applicant pool has looked like and what does that mean. These are just some very high-level aggregate numbers. So overall, the typical applicant that made application on average had about 16 years in business. Again, some were less, some were higher. That's kind of what the average was of this first tranche. About 120 plus staff that represented a combination of full-time, part-time, or temporary was kind of the aggregate staffing number associated with this first batch that we processed. In terms of the total leverage dollars requested from other recovery sources, predominantly dominated by the feds, so it could be the PPP program or the IDA program or kind of filling the alphabet soup. That was clipping along at about $357,000. And in terms of the actual funds secured from those sources, it was just slightly over $180,000. So about half of what was applied for was actually received from these external sources. In terms of our side of the equation, the total request from the first batch of applicants that were ready to be processed was $257,000, and not surprisingly, most had requested the maximum amount. In terms of kind of what their quarterly cash flow needs, again, the aggregate numbers, we're talking substantial numbers. I mean, you're just shy of $600,000 was kind of the combined quarterly cash flow needs of those particular individuals. So that's kind of where we're at for a quick status update. And obviously, as loan documentation is approved and funds are dispersed, there'll be more information about the loan applicants and or borrowers themselves. Again, high-level information, but that's kind of where we're at today. So I'll go ahead and defer the floor to John and the rest of the program here. Thank you.
Well, thanks, James. And I might mention that at the bottom of the email flyer that we sent, or email blast that we sent you, is a link to the Rock County Emergency Small Business Fund, so you can get directly to those documents that James just mentioned. And I know you kind of layered it in there, but I just want to repeat, you are still accepting applications, right, James?
Absolutely. So applications literally are accepted on a rolling basis. So what does that mean? You could appreciate that some applicants were fully prepared and engaged when they sat down to fill out the application out of the gate. So they filled everything out completely and submitted it. Others perhaps have taken a more incremental or piecemeal approach where they started it on a Tuesday and perhaps picked it back up on a Thursday and perhaps finished it on the following Monday. So there's a variety of different states of applications that are continually rolling in, and we process those on a rolling basis. So we check the website on a daily basis in terms of drawing down information, and there's a fair amount of information flow back and forth between the applicants and kind of the documentation that they submitted to date. And for those that have experienced challenges with either identifying and or actually submitting information, there is help out there. So what I mean by that is certainly at the bottom of our application page, there's a website and a phone number, and I would highly encourage folks to use the website just because of these days of working remotely. It's much more efficient to have an email forwarded accordingly to our staff and to have those answers provided in a more timely basis. So it's not uncommon for me to be exchanging information with applicants on a daily basis. Matter of fact, I was on a Zoom meeting this morning where some updated information came in from one applicant that we were requesting and waiting on for, roughly the last 2 business days. So there is help out there, there is support, and again, I would encourage folks to really make sure you read the 2-page summary that's online, and then clearly if you have any questions and want follow-up, drop us an email. We'll make sure we get back to you. So thank you.
Thank you, James. Now I'm going to turn to Dan Cunningham from Forward Janesville, who's going to give us the latest update on state and local, and federal rather. Dan, are you there?
I am. Hello, everyone. Hope you can hear me okay. So thank you for that introduction. So I continue to contact state leaders regarding our Better Together framework, which is the proposal for a statewide bipartisan public-private recovery task force. You may have seen that the Gazette endorsed the framework in Sunday's paper, which was certainly encouraging. The Milwaukee Journal Sentinel ran an op-ed piece on the framework, and I've been in contact with other news organizations across the state. I'm working to book some additional radio and TV appearances this week, so stay tuned for more information on that. I had hoped to come on this call today to give you an update on the Supreme Court's decision on the Republicans' challenge to the Safer at Home extension, but they're taking longer than expected to render their decision. Meanwhile, Governor Evers continues to turn the dial on our state's recovery. We woke up yesterday to Executive Order 36, which allows some retailers to reopen, for 5 shoppers at a time. And while this is great news for some of our smallest businesses, I'm anxious to see how this will work for larger retailers. Now, I'm going to get a little challenging here, so bear with me. Limiting occupancy to 5 shoppers in a store the size of, say, an Old Navy or Kohl's doesn't make a lot of sense to me. This order seems to be kind of a one-size-fits-all solution. I think a task force like the one we have proposed would have encouraged the governor to put some nuance in the order. For example, why not consider a sliding scale based on the square footage of the store? This is exactly why the task force framework is so necessary. From where I stand, the state isn't getting much input from the business community before these decisions are being made. I'd love to be proven wrong, but I frankly don't see any evidence of it. The governor's office is going it alone, and they really don't have to. The consequence of this leadership vacuum is frankly a thoroughly confused business community and 72 counties working individually on their own reopening plans. This is exactly what we wanted to avoid. State leaders have missed countless opportunities to collaborate, and this patchwork reopening is kind of what you get. But now it has happened, and we need to pivot. So I want to switch gears and talk a little bit about our local response to the crisis. The world will look back on 2020 not only in terms of how many lives were lost, but in terms of economic damage, how many businesses closed and how many jobs were lost. We really have to focus on the opportunity to come out ahead on the other side of COVID-19. Janesville's made such great strides in the last decade, and we must protect the vibrancy we have created. We cannot give up this ground. The Wisconsin Restaurant Association has said that as many as 50% of restaurants could close if current conditions last through the end of this month. But we don't have to lose 50% of our restaurants or other businesses in Janesville. That may happen in other places, unfortunately, but it doesn't have to happen here. It's really up to us. Once we're given the green light to fully reopen, it's going to be time to circle the wagons and support Janesville businesses. So we're exploring a marketing campaign to encourage our citizens to support and shop Janesville businesses safely. We've also encouraged the city to think outside the box and explore innovative ideas that will allow businesses to thrive in this new normal. We've asked them to consider things like expanded outdoor seating for bars and restaurants for the duration of the crisis. And for those who don't have outdoor seating areas, why not allow them to use, part of their parking lots for outdoor tables? I know that restaurants in other states are doing this. After all, who doesn't want to go have a great meal and a cocktail on a beautiful summer day? I'm sort of daydreaming about that as we speak. We've never faced a situation like this, so we really need to get creative and flexible. I encourage you to contact me if you have creative ideas about how businesses can operate safely in the post-pandemic world. Because, folks, there will be a post-pandemic world. That world may look a little different from what we're accustomed to, but we'll make the best of it together. Just know that working with our partners at the city, the county, and in the private sector, we're doing everything we can to make sure that Janesville comes out of this crisis standing tall. Together, we are Janesville strong. Thank you, John, for the opportunity to speak. Stay safe and keep the faith. I'll turn it back to you.
Okay. Well, we have a lot of questions. Some of you may have dialed in a little bit late. We have Noel Sandoval, who's the health officer for the Rock County Department of Public Health, and James Otterstein, who is the Rock County Economic Development Agency Manager, including, of course, in addition to Dan. Noel, I'm going to start with you. Lots of questions coming in about testing and testing resources. There's one here that says, I've seen several pieces in the local news where local health providers getting the test either cost prohibitive or difficult. The question from this caller was, are you actually managing the availability of tests or just reporting on what other organizations, namely health organizations, can provide?
Right. So public health, we all have, there are a lot of roles that are being played in this pandemic. Public health's role is more the case investigation and contact tracing. We don't actually do the testing. We do report on the availability of the testing. Normal channels for testing are by order of a physician or a medical provider. But we can help expedite priority testing for some groups. For example, if we are sensing that we are having some cases showing up at places where many people are either working or living together, we can request priority testing from the state for those particular businesses. So that would be the role we would play in the testing. We also play a role in, so for some testing plans for the county, we would hope that we could prioritize vulnerable populations. For example, our skilled nursing facilities for testing. The state is offering to test all skilled nursing facilities if they want that. And then as far as you've heard, I'm sure, about facility-wide testing for those manufacturing facilities, and we're helping with those types of efforts, again, prioritizing, vulnerable populations. And then community testing for disparate groups, those who have, for whatever reason, access barriers, lower socioeconomics, minorities, things like that. But if we can keep this systematic and planned, it's ideal, because testing goes hand in hand with that contact tracing that you've heard about in the news a lot. So if you do a ton of testing, but you can't follow up speedily, that testing isn't as good, right? So we need to balance all of those things, and that's why that priority, targeted testing is important.
Yeah, prioritization is just logical. That makes a lot of sense. The question, and I apologize if you actually talked a little bit about this, but I want to make it perfectly clear. What is the capacity that we have right now, and what % of our testing capacity are we actually using?
Okay, so currently testing capacity is a statewide number. So there are a variety of labs throughout the state that actually do the testing. So the last number I had is capacity of 85,000 tests can be run a week. I'm not sure that all of that testing capacity is being taken advantage of, but we are having community testing statewide. So I think that testing capacity is being challenged. But they're keeping up. We're having some community testing events, manufacturing facility events, and then, these assisted living or long-term care facility testing. So there's a lot of testing happening. I hope that answered your question. So far, we know of, in Rock County, 3,739 tests that have been conducted. That was as of yesterday for Rock County. And 361 of those have come back positive. The rest, 3,378, were negative.
Well, we were in the news, I think, last week as a top 10 hotspot in the country. I believe I got that right.
Right.
Correct me if I'm wrong, and help us understand why we would be such a hot spot nationwide.
It may have to do with, we have a number of manufacturing facilities in our community, and even in our neighboring counties. So the way the contact tracing goes is it goes with the residence of the person. So for the outbreak that occurred over in Walworth County, we got a large number of those folks that were residents of Rock County. And so our numbers have gone up substantially lately. But I feel that it has to do with some of the manufacturing facilities and the increased testing for those facilities.
Thank you, Noelle. James, here's an interesting question. It's a little bit far afield from the program you described, but the question is, what is the future of Rock County 5.0? And given its success over the last 10 years, is there a chance to deploy this program to focus on our recovery efforts?
So that is a very, very good question, and certainly the answer that I'm going to provide is not going to be sufficient given the time that we have here. But the reality is this particular program that I briefly highlighted represents a tool, and a tool that can be used certainly to help facilitate small business and entrepreneurial development, which is one of the 5 foundational pillars of Rock County 5.0, as well as to help secure and sustain existing business retention expansion activities, which is yet another pillar of the particular Rock 5.0 initiative. And so rather than, having to recreate the wheels, so to speak, and to create a whole other organization, and frankly, because there were timing considerations, it was much more efficient just to run this through the County of Rock formation versus trying to figure out a way to create an add-on, right? But the reality is it's part of the overall ecosystem, and certainly is there to help facilitate and advance, the repositioning and revitalization of our economy, take 2. So the first efforts of that associated with a public-private partnership certainly took place in fall of 2009, and then really got underway in Q1 of 2010, and then unfortunately here we find ourselves back in a different but yet similar situation of recovery and revitalization and repositioning. And so certainly the public-private partnership that was certainly instrumental in helping to support and sustain and promote Rock County 5.0 is certainly remains alive and well today, albeit perhaps in some different twists and turns. But the reality is this type of dialogue that we're having today, the type of dialogue that's occurring outside of these calls, that entire framework is still very active and fluid and functional, and certainly I think we're going to see more of that moving forward. So apologize if that wasn't a very direct answer, but there's a lot of topics woven in between the remarks that I made, as well as the foundation of kind of that public-private partnership.
Well, as someone who sat next to you 10 years ago when we put that program together, I can just add that there's a great opportunity to use the bones of that structure to help us over the next months, I hope not years, but however long it takes to bring this economy back. Okay, I have another question. There's multiple questions about personal protective equipment. And I'll start with, here's a small retailer. We're caught by surprise by the governor's order that we could open today. We aren't sure what PPE we need. And that is tied to another question to Noelle, is how active is Rock County Health in working with our businesses and the community to identify the needs of personal protective equipment and how those businesses can get what they need. Noelle, can you address that?
Sure. So, many of the businesses, the order yesterday also caught us off guard. Just so you know, we're not being public health voice isn't necessarily from the locals going up the chain either. But PPE, it would depend on your particular situation. So, things in a small retail, what you might want to do is encourage, and you could even say, I want anybody who comes in my store to wear a face mask. Again, keeping in mind that the face masks, the cloth face masks and the face masks that are out there for the general public are protecting more others than you, but they're still protecting. And if everybody wears a face mask, all that moisture coming out of your mouth and nose doesn't spew out into the environment and might potentially have viral particles in it. So that might be one thing you might want to do. You might want to also just keep track of who's coming in your store in the event that we do have somebody who tests positive. We could track back where they were. So those are just a couple of things, having hand sanitizer, cleaning surfaces frequently, minimizing touch points if at all possible. I know in retail it's kind of hard to do because people want to touch and handle everything. But if you have any specific questions, send them to us. We have an email box, and we will get somebody to respond to you. Our environmental health staff work with many businesses on a daily basis, and we'll find the answers if you have a specific answer, or we will channel you to a particular place. We also put out these informational Q&A videos every day. Not every day, once a week. So if you have particular questions, send your questions there, and we will provide information because if you have those questions, many others might have the same ones, and we could help a lot of people at once.
We will include that link on all the communications we send out hereafter, so thanks for that tip, Noelle. I guess the one question that still lingers is, are you, as a health department, in a position to help businesses find the PPE that they need?
So PPE needs, what you can do, once you identify what your needs are, there are municipalities, Janesville and Beloit have an EOC, Emergency Operations Center, and if you have PPE needs that you cannot obtain on your own, you can submit your request to them. And if they're not able to help you, it would move up the chain to the county Emergency Operations Center, and then if at the county level we can't help you, we would move it up to the state level. Excuse me, my home phone is ringing.
We've all had that. James, here's a follow-up question. This person has read an article about the potential for 25% unemployment, which they claim is depression-level unemployment. Is this a concern for you long-term, and what can we help to do in the near future to try to force that percentage down?
So is this question for me?
No, it's for James.
Okay, that's what I thought.
James, I think there's just some people who are frightened by the percentage of people who are now unemployed. Is there anything you can say about that situation that might be helpful or encouraging? I think we may have lost James. Well, I know.
How about that, John?
Oh, there you are. Did you hear my question?
All right. Yes, I did. Thank you. Certainly the rising numbers are alarming, and I think they're going to continue to be alarming. So what can be done or what should be done? I mean, clearly this is catastrophic, right? I don't think there's any other word to describe it. And the reality is it's almost a tale of two economies. And what I mean by that is you've got certain segments of the economy that are very, very busy. And quite honestly, we're extremely busy prior to the pandemic rolling in. And then you have others that obviously were severely devastated by the pandemic that are going to have a much longer road to recovery because the rules of engagement / operations are going to be conceivably different moving forward. So the reality is there are folks that are going to be in transition, and some of those transitionary periods are going to be determined on an individual household basis, and so it may be accelerated or it may be extended based on those unique circumstances within inside the four walls. The reality is there are a number of employers that are continually looking and staffing up, whether it would be on a part-time or a full-time basis, and I think that situation isn't going to change anytime soon. And I will tell you, just from an overall kind of economic development pipeline standpoint, there are a number of sizable and substantial projects that we're working on, even in the midst of this uncertain economic cycle that we're in. But there are certain industry sectors that are poised and positioned to really hit it, at 150% once the dimmer switch is turned all the way up, or at least turned up to a level that allows them to do that. And so they have rather sizable employment needs associated with it. So I don't think there's going to be a shortage of opportunities, but it will come down to, do those opportunities match the needs, the wants, the profile of the particular displaced, worker pool that our current, Janesville Beloit MSA is going to have before it. And so much like happened in, the 2008 to 2010 timeframe, there may be some folks that will be faced with a potential career and or occupational change. For some, it might be an easy transition. For others, it will be much longer and a more difficult decision to be made. And I think our economy will continue to evolve around the asset, skill, and talent base that we have here. And it's hard to believe that 60 days ago we were continually talking about a labor shortage, right? And that was top of mind. And now the switch has been reversed, and it's completely opposite on this front. So I think it's going to be an ever-evolving situation, right? Very fluid. But I do think that there will be ample opportunities for certain categories of classifications of workers moving forward, particularly those that have an opportunity or want an opportunity for a transition. And again, it's not going to be a one-size-fits-all approach for everybody, but I will tell you that assuming nothing strange happens with the national economy, we're fairly optimistic about some of these pipeline activities that we're actively dealing with on a consistent basis, that those investments hopefully will come to fruition, and when they're made, they will have sizable employment requirements associated with it.
That's great. One thing's for sure, we're a lot more diversified than we used to be, and that can work to our advantage. Noel, the next question is kind of touches on the testing, but those of us who have been tracking the national news and the like, there's another form of test out there that tells whether or not people have the antibodies in their systems for this COVID-19. And I think the word is seroprevalence testing. Technically, it's the prevalence of the virus in the population. The premise here is that a lot of us have potentially been exposed to this virus, and we don't even know it. Is there any talk about that kind of testing to try to get a bead on how much of our population has actually been exposed to this virus and may not know it?
Right. That's a great question, and actually that would be the gold standard for things such as measles. We rely on that serology testing to inform us whether somebody has ever come in contact with that virus or recently. So there's IgG, which is I always like to think of IgG antigen as days gone by. So if you've ever been in contact with that organism, that would show positive. And then there's the IgM, which is the immediate or the more you recently had an infection. So that would be very indicative. Currently, unfortunately, the serology tests are not overly great. The best one they have so far has about an 85% accuracy rate. So that's looking at a 15% false negative. But it could tell us something. I know that currently they're using those types of testing more in a treatment capacity and in a hospital setting, and it's not available widespread. You probably have heard a lot about it on ads and TVs, and a lot of them have not been good tests. So they're still working on that, and that would be optimal because then we could test everybody and know if you had ever come in contact with this. The other complication with that is how long immunity do you have? For example, with measles, if you have been vaccinated for measles, then you pretty much have a lifetime immunity against that virus. For COVID-19, that's not been determined, how long your immunity lasts if you have been in contact with it. So there are a few complications. This is it's a new virus. It does mutate a little bit all the time as well. So it's changing a little bit. And so that also is posing a challenge for vaccine creation as well as serology testing. One of the other complications with serology testing is there are four other coronaviruses that we normally see in the population, and those are the ones that give you the common cold, basically. So there's cross-reactivity on this serology testing, so it's not as specific. Some of it it's cross-matching. So if you ever had one of those other coronaviruses, which most of us have had and come in contact with, it would tell you that you did have some immunity, but it may not be specific enough for the COVID-19 virus. So hope that helps.
That's very educational. So most of us have had the coronavirus. It's just a different type of virus than COVID-19, if I understood what you said.
Right. There are several coronaviruses circulating that we have come in contact with in our lifetime. And like I said, they cause a common cold. But this coronavirus 19 is new. It's different. And so as a result, it's causing a lot of, havoc for everyone.
Yeah. That's an understatement. I have several questions. People are on clarification. Is it true that you said earlier in the call, Noelle, that the governor's announcement to open up small businesses or small groups of people came as a surprise to you?
Right. We have at the local level of health departments, we meet with our state health department pretty much on a daily basis, and we provide information and feedback, and they provide us with information. And we have requested many times, every single time that, if there's an order coming out or if they have knowledge, could they give us a little heads up so we can prepare? But the reality is that we hear about it when everybody else does.
Oh, boy. Okay. James, here's an interesting question. Is now a good time to talk to companies from major urban areas or the coasts who might be looking for a place to set up shop that isn't most likely to be a hotspot?
So the short answer is those types of dialogues are ongoing, and nothing, obviously creates an opportunity like a crisis, right? Sometimes those conversations and those efforts are not warmly received because they're viewed in a very pessimistic lens. But in most cases, when you get hooked into the right frequency and you're communicating with, the right message, they can be received. But it's not as simple as, hey, you make a phone call, you drop an email, and you go from there. These are long-term relationships that need to be built, and certainly there's a variety of factors that are balanced and weighed accordingly, not just over a short-term window, 18 to 24 months, but they obviously look at longer-term, 10 to 20 to 30-year financial pro formas associated with, locating and doing business in location A versus B. In order to do that type of campaign, clearly you've got to have a lot of resources, and you have to have a commitment to use those resources in that particular realm. And so those are certainly decisions and strategies that I'm not in a position to comment any more on today, but it certainly is an idea that has been floated, and certainly it's an idea that certain organizations in certain parts of the country are attempting to deploy rather aggressively, and I think it's a bit early to determine whether A, it's been successful, B, it's been received at least mildly on behalf of those that are the recipients of the message, and last but not least, whether there's been any traction on it. I think it's going to be a little bit more of an uphill battle than what we experienced, in 2008 to 2010 timeframe in terms of reshaping the narrative, in terms of recreating the brand and then in terms of creating the appropriate message and the actual platforms for those messages to get to the intended audience.
Yeah, that is a long-term proposition when you're talking about building those relationships. That typically just doesn't happen overnight. One final thought on personal protective equipment, Noel. We have at Forward Janesville engaged in a survey of our members, and we have gotten some valuable information back about their needs, about the lack of information, a proper way to use it and maintain PPE. And then, of course, there's always questions about sourcing. And there's one question here about how on the earth, after almost 2 months, can we not find an adequate supply of professional N95 masks? That's just one of those items that you would think by now would be readily available. Do you have any sense that the pipeline for this PPE is truly improving and filling with the needs that are expressed by people and businesses across the country?
Right. So one of the big issues is its competing needs. So every state, every county is competing with each other for PPE. And the N95 masks, which you're probably talking about, those are of greatest need because those do actually protect the wearer. Up to 95% of the virus particles would not get through that mask. So that's why those are used in a direct care setting, hospitals, public health, things like that. One of the good things, though, that has resulted recently is the disinfectants, the decontamination capabilities for the equipment, the PPE we do have. Professional ones, at least, N95. So there's a system called Battelle, and the state has secured a contract with Battelle, and basically, like for public health and hospitals, they can send their used masks, pre-labeled with a pre-code, over to the state. They get decontaminated, they get sent back, and multiple wears on that one mask, if they can get decontaminated. So that is helping with the PPE shortage. The metrics I received this morning from my epidemiologist indicated that the hospital systems are reporting adequate supplies of PPE at this point.
Well, that is an encouraging note to wind things up. I greatly appreciate your time, Noel and James and Dan. Noel offered up that the Rock County Health Department website has a variety of statistics that are available. I encourage our callers to check that out. James, of course, talked about the Small Business Emergency Loan Program that Rock County has, and that he has made it clear that there's still plenty of money available for those who qualify. So I would encourage everyone to check that out. Again, the link is at the end of the email we sent to you, or you can go to the Rock County Economic Development page and you can get a 2 or 3 page summary of the program and the application. It's all already there, all available for you to evaluate. Dan, thanks again for the updates. I hope that this was an informative opportunity for all the callers. Appreciate you dialing in, and look for more very thoughtful guests next week. Please have a safe week, and we'll talk soon. Thanks.